name is Danielle Leon, and I'm presenting on unintentional injuries. So the statement of purpose. Unintentional injuries are going to be injuries that are caused by accidents. So they're considered motor vehicle related, fires, drownings, traumatic brain injuries, falls, suffocations, poisons, bicycle accidents, and many other injuries. Now, unintentional injuries are actually the leading cause of death in children and teenagers. So preventing these injuries is going to be very important. So we want to teach parents how to protect and prevent these injuries from occurring. Once this has happened, the rate of unintentional injuries can be decreased. So children and teenagers are going to be vulnerable at all different ages and places. So unintentional injuries occur at home, school, on the road, and during recreational activities. In developed countries, unintentional injuries are the leading cause of death. In undeveloped countries, unintentional injuries are actually rising. So there's a difference between the upper level and lower level income families. So children in poor backgrounds are actually at a 5 times more likely to die from unintentional injuries. There are about 2,000 deaths a day, which averages out to about 830,000 deaths per year because of unintentional injuries. So, but more about occurrences are the demographics of the children and the parents actually. So it could be age, sex, education, income, healthcare, and lifestyle. The more active the children are, the greater risk they are for unintentional injuries. So in one study, it was found that falls occurred for 70.5% of unintentional injuries, and of those, 45.4% of the children fell at their homes. So there's going to be many different risks for unintentional injuries. So there are the minor injuries, which occur in our everyday lives. So children are going to be taking risks, and in doing so, they're going to cross boundaries that are going to hurt them, but in the end prevent the injuries from happening in the future because they know how far they can go. It's stated that males are actually at a higher risk for unintentional injuries because they take more risks and are more active than females. So in parental supervision, the parents or the caregivers of the children are going to play the essential role in protecting children. They're going to be the ones that supervise the children and know what should be done. They're going to have the knowledge to prevent these injuries, whether it be from the way the children behave to how often they leave them alone. So these unintentional injuries can actually cause an emotional toll on the family. It can have the child show up less to school, be less social, and actually cause a financial strain on the families. So strategies to help this would be give more education, environmental modification, find at-risk children, find supporting parents, and even gain active advocates that will help show preventions for unintentional injuries. So there are 6 recommended categories of unintentional injuries. These are going to be the general unintentional injuries. There's workforce training and capacity building. There's injury surveillance, home safety, outdoor play and leisure, and even road safety. There are also 3 E's of injury control. So they're going to be education, environmental modification, and enforcement. So, education is going to be when parents and children get put into groups to work with schools, primary cares, and communities to get ways about prevention of unintentional injuries. The enforcement is going to concern legislation, regulations, and standards to promote safer behavior, safer products, and a safer environment. For the environmental modifications, they're going to make changes to the specific products, the physical surroundings, and the social environment. So for the variations of injuries, so it all depends on how active the children are, their behavior, and all that relies on the different age groups. So for lower socioeconomic status children, they're going to be more vulnerable to unintentional injuries. So it was said that kerosene was actually the leading cause of death for poisons, whereas nuts followed by coins were actually the leading cause of choking deaths. So with the increase in activity, there were going to be a greater risk for these injuries to happen. And just different ways to prevent these would be to improve the education of these children and their parents, and for the lower classes, improve their living situations. So for more parental knowledge, there was actually a study done for in pediatric offices when the parents went to take their children to the doctor. Before they actually got to see the doctor, they were actually given a test on a computer. So what happened was that there were two different systems. One of them was tailored and one of them was general. So the tailored questions were used for that specific child. So the parents answered like what their age was, how they've gotten hurt, and questions that followed that were related to them, and then given information for those specific injuries. There was also the general section, which just based on the unintentional injuries on anything for any age group. At the end of the study, it was shown that 48.6% of the tailored parents had adopted a new behavior change, and 31.6% of the general questions, their parents adopted a new behavior change as well. So more about home safety. The National Institute of Health and Clinical Excellence provided a statement of home safety, describing it as the process of systematically identifying potential hazards in the home, evaluating the risks, and providing info or advice on how to reduce unintentional injuries. So it was said that 45% of parents think it's possible to prevent unintentional injuries. So the intervention strategies. So as it was stated, the causes of intervention are the causes of unintentional injuries are the motor vehicle related injuries, the fires, drownings, traumatic brain injuries, falls, suffocations, poisons, bicycle accidents, and many different other things. So the parental involvement is going to be very important for making these changes. So a teacher could have the younger students, draw an unintentional injury. Each student would be given an injury and then have to go home and talk about it with their parents and find ways to prevent the injury from happening at their home. Once that's done, they would then draw a picture of the injury and how to prevent it, and then bring it to class with them when it was done. The teacher would then post it on the wall for all the other students to see. Now for older students, they would have a writing assignment about a couple paragraphs of the specific unintentional injury that they were given, and then have to present it to the class. Another good intervention strategy is having a guest speaker. So the teacher would most likely choose a pediatrician. They deal with children every day, and they are actually been called champions of injury prevention. So they could give more in-depth details about ways to prevent injuries and just examples of what they have seen. So to evaluate all of this, the teacher would look at the creativity and how involved the student got in the project. So for the younger students, with the drawing that they had done in the intervention, they would have to choose another student's drawing and then explain to the teacher what's going on in the drawing. This would show the teacher then how much they know about unintentional injuries and how well they can understand the drawing. They would be graded on a scale of 1 to 5, and 5 would be that they clearly understood the injury and how it was prevented. So for older students, along with a couple of paragraphs that they had to write about their unintentional injury, they would be split into groups. So half of the groups would work on role plays, and the other half would be buzz groups. So for the students doing role plays, they would each get an unintentional injury and then have to present the skit that they did to the class. When the skit's done, they would have to answer questions that the students have or that the teacher has for them. And they will be graded on how well they did and how well they understood the topic. The buzz groups would each have their own unintentional injury and have to discuss and find precise info on the unintentional injury and then present it to the class. At the end of that, they will be graded on a scale from 1 to 5, the same as the other children, and it will be based on the fact of how well they conveyed their information to the other students and if everyone else could understand it.